Hi, delighted to be here. It's a great question to start with. And when we are talking about psychedelic assisted therapy, so the first and foremost, the therapist has to be a therapist. And there are, differences that there are psychedelic guides. There, is a lot of discussion about doing co-therapy with a therapist and a second person who might not be a therapist. So there are all these different possibilities. But when we are thinking about psychedelic assisted psychotherapy, it's first to be a therapist, and then Janice Phelps in 2017 wrote a great article where she described the 7 competencies of psychedelic therapists. And I think there's still, what we could look at and think about when we train therapists. And, those areas are connected to the personality of the therapist and their self-awareness, their ability to reflect on themselves, to sit with their own experience and then hold space for clients, and the ability to create trust in the relationship and understand the variety of experiences the clients can have. And then, having a knowledge of the psychedelic molecules they're going to be working with, knowing their physiological and psychological effect they might have, and knowing the differences between the different medicines. It's I think there is this underlying training for psychedelic assisted therapy, but then there needs to be specific trainings for working with the different medicines. And there is the proficiency in the different models and therapies that are used that are kind of good fit for working with psychedelics, so the guiding principles of the work and the variety of approaches that are being used with the medicines. And really important, the integrity of the therapist, having ethical values that they can abide to, and that they are seeking supervision and consultation. So someone who wants to grow, who understands that it's a journey of becoming a therapist, becoming psychedelic assisted therapist. So there is this ongoing conversation, support, consultation, and that people are open to that. So I think there could be much more said, but I want to give it to Steve. If Steve, you want to add some things here.
Yeah, no, I think that was a beautiful answer. The things that, that really resonated was, the self-awareness piece. I think we all have a conscious mind and a subconscious mind. And unfortunately, we're sometimes making decisions or reacting from our own subconscious. And so it's imperative for us to all do our deep inner work around these pieces. I'm also currently in another training program that's, we're actually reading a book called The Ethics of Caring by Kalia Taylor, which I think is one of the best books I've seen so far that go directly into what is your own internal intention and your own internal ethics. I mean, I also live in Oregon, so there is going to be sort of a paradigm shift happening because we've now legalized psilocybin, and to be a guide for that program, you actually don't have to be a doctor or a therapist or, basically the requirement that they're asking for initially is a high school diploma and then some training that is currently being built. So, I think with that, there is, I think MDs and therapists have a path that is sort of defined to sort of what is the right relationship with patients and clients. And I think this whole, I'm just hoping that gets taught in this training program in a sufficient manner that there isn't anybody injured around this new paradigm that's coming forward. Well, I think this, supervision is incredibly important. As you're sort of, as you're, most of our training when you're a therapist or a doctor, you're going through some type of training, whether it's almost like an apprenticeship where you're below other people or people are monitoring your work. And I'm hoping that is a huge part of this going forward. Oftentimes people have these experiences with medicines and they have a couple of experiences and then instantly they're like, oh, I want to be the person to bring the medicine to the people, sort of thing. And at that point it is imperative to start doing the deep dive into your own subconscious and making sure that you're coming from the right space. But yeah, there's going to be a didactic component for sure. And then, practicing with other practitioners, the supervision and ongoing supervision, I think is important as well. But I think Veronica is more involved with the MAPS side of things and probably has a better sort of gist on that.
Yeah, I kind of appreciate, Steve, what you're saying about kind of the length of the training, because it is a journey and we are in this interesting time when we are moving towards, hopefully these medicines being rescheduled, ketamine being already available. And a lot of people just kind of suddenly gained interest in providing this type of psychotherapy. And so there is this need to be trained, but then there is the reality that it takes time, that it's not possible to do few days training and be proficient in being psychedelic assisted therapist. And so that there is that theoretical base, but then as the clinicians are learning, they're as well developing, they're changing the way how they show up in the work. And so then there is this I think really important to like watch other people work, watch sessions, and having, as Steve is talking about, is mentorship, supervision. And that it might take many months to years to really become the therapist. And so at this time there is a lot of efforts around credentialing and what are the requirements, because it's something completely new. And to in addition, I think is important to have personal experience, and it is a controversial topic. It is a question how we can do that, when it would be legal, and like can prescription medication be used for a healthy individual to kind of deepen their ability to hold space. But I think having personal experience with non-ordinary states of consciousness, and ideally with the medicines the person is working with, I think is really crucial. And it is different than when we talk about medication that's prescribed for psychiatry, or even in regular psychotherapy, the therapists are required to go through psychotherapy. If you're learning a new approach, you will be asked to be months in that type of therapy. So I think that's another important part in that, like in the MAPS, there has been this studies MT1, MT2, where therapists could go and have the experience. And some of the ketamine assisted psychotherapy trainings as well offer this experience, which I think is important to do in the process of training. And there are a lot of topics that are specific, I think, to psychedelic assisted therapy beyond the how the medicine works, what are the effects around the relationship, about the issues of transference and countertransference, that I think are really important to look at and learn about, because oftentimes we say that one psychotherapy session with psychedelic can be like 10, or some people say even 50 regular talk therapy sessions. And so that's the amount of material that can come up. And so there is this greater holding needed by the therapist, and the attachment challenges or issues, or the issues of transference and countertransference, really come up and are available. And so the therapist has to know what can come up, seek consultation. But I think that's a really important part of the training as well.
Yeah.